far as treatment for osteoporosis, amazingly over the last decade or two, we've been able to decipher bone physiology and we know how to actually treat this problem. It's generally treatable up to age 75, maybe even 80. And the whole importance of why we need to treat it is it can prevent catastrophic fractures of the hip and spine in particular that will shorten your life. And once you establish that your bone density is poor, you can treat it now with various medications that have come out over the last decade or so that are highly effective in increasing the strength of your bone to prevent these fractures as you get older. And we've had some really miraculous drugs come out that have actually been able to increase the strength of the bone. And these are things that there's very set protocols now that can be started by your medical doctor. Or in my case, as an orthopedic surgeon, I would start these before surgery if it was necessary, if we found your bone was too weak to do surgery. And it can really change the prognosis in your life long term. And so just something as simple as taking 2,000 to 5,000 units of vitamin D daily, if you don't get out in the sun or you have a family history, or you can get your vitamin D3 specifically, D3 levels checked. And if they're low, you can bring them up to normal levels. Why that's important is vitamin D directly directs your intestines to absorb calcium for your skeleton. So if you're low in that, your calcium absorption is low, and you gradually, over your lifetime, leach more and more calcium out of your skeleton, and you end up getting osteoporosis and getting these fractures. So these are all treatable problems that with just daily supplements, which should start after the age of 25 or 30, you really should be taking calcium, particularly women once you get into the childbearing ages, and take it your whole life to make sure that your vitamin D levels in particular are within normal limits so you don't, it'll slow down the process of osteoporosis.